Hello, and welcome to another episode of Wellbeing at Work, a podcast by Workplace Options, a TELUS Health company. I'm Emily Morgan, a digital marketing intern here at Workplace Options, and today I'm joined by Kender Wu, who is a clinical counselor at Workplace Options. Today, we'll discuss the growing burden of compassion fatigue within the healthcare industry, how it contributes to burnout, and what leaders can do to respond to and prevent it. Welcome, Kender. Thank you so much for joining me.
Thank you for having me, Emily.
So to get us started, I was wondering if you could talk a bit more about compassion fatigue, what it is, and why it's such a critical topic in the healthcare industry.
Sure. If I may just start by, how it might have been misunderstood, first of all. A lot of people may have thought compassion fatigue may sound like people either not caring or just stop caring all in all, right? But to me, it's actually not like that. It's more about the cost of caring that like people like ourselves, healthcare professionals or counselors that have been just spending a lot of time, having emotional interaction, psychological work with our clients, and throughout the course, the kind of distress we accumulate over time, and as a result of that, because of our repeated exposure to trauma, crisis, suffering, grief, just all kinds of human vulnerability, right? We do have that like fatigue deep in. It's more about, I would say, it's more about caring deeply for prolonged periods instead of just stop caring all in all, if that makes sense.
Yes, it does. I understand with the compassion fatigue, that phrase makes a lot of sense with what you're saying. And I understand there's also data has shown there's been somewhat of a gradual decline in physician burnout. Obviously, decline in all aspects of healthcare burnout is the goal. So why is it important for leaders to take action so we can see more of a decline? And what is at stake if organizations fail to respond?
Great question. So as you can imagine, professionals like ourselves, we do make use of our self, right? This professional self or this personality, into our work. Meaning, there's a lot of what we would call our emotional labor, and not having this part of ourselves taken care of would indeed just spill over to how we may compromise our professionalism. So if I may just put in a little remark in here. So normally we talk about burnout and ordinary workplace stress issues, right? But I would say really compassion fatigue is a little different from that, as also related to what we call secondary trauma or secondary traumatic stress, meaning when we experience what other people are experiencing, we absorb their so-called energy and we feel, we empathize and we feel what they're feeling. And that's essentially how we kind of drain ourselves because of that as well. So we got to take care of ourselves. And apparently, we have been addressing it as more like an individual issue. If I may emphasize a little more, it's not just about the individual professional. It's also about us working as a team, how the organization, how leadership can respond to that. So I do have a lot to say, but I've got to take a pause right now. I'm gonna let you lead me a little further from here.
Yes, I just mean, obviously with healthcare, people's lives are on the line. So I guess if organizations, they don't respond, their employees are burnt out and struggling with this issue, I assume there's a lot at stake if this is not responded to correctly.
Right. So it might just add to that. As we're working, let's say on the helpline, right? There are moments that we feel the vulnerability of the other individual, and hence we need to feel vulnerable to feel the other person, right? And listening to them, witnessing suffering, listening to the kind of crisis they've been through, it could be rather emotionally impactful from time to time. And not to mention, in certain occasions, we need to, when the calls are kind of busy, we need to just move quickly from one case to another, just to respond to the next case right away. And there's often very little opportunity to process deep down what's going on emotionally between encounters. And why it matters is because first of all, it does have that individual impact on ourselves, the emotional exhaustion, enhance the reduced well-being, reduced engagement, and all that. And ultimately, I believe with reduced engagement, chances are, we may feel a little less, easy to maintain the empathy, and that could, also lead to perhaps a loss of meaning. Right? At the end of the day, we're just asking what we're doing if we cannot do it professionally, if we cannot empathize with another person, and that indeed affect our professional identity as well. So it affects the organizational, you know, work in a way, and the service quality as well. So I believe it's important that we address that as well.
Not just the individual having, like their professional identity being affected, but also it'll trickle down to their patients and just the organization as a whole,
Indeed.
is what I'm understanding. All right. And then, we're talking about, of course, the implications if this isn't addressed. So, how can leaders, specific strategies, I guess, how can they implement an effective strategy against burnout? And I guess, what does that entail before and after burnout strikes?
Great question, Emily. If I may just put in, a word in here, I would definitely want to suggest a shift in thinking. We used to think in a way that, how do we make people more resilient? How do we solve individual problems, so to speak, right? But instead of that, why don't we think more about how do we create conditions that allow people to continue doing meaningful work sustainably? So instead of just, taking care of individuals, we got to set up, really in terms of the organization sense, how we get people together to talk about stuff, how we normalize the conversation about maybe burnout, disengagement, whatever human cost it may take working on the lines, or being a healthcare professional, or even the topic of loss of professional identity. As you could imagine, compassion fatigue may lead to reduced connection to work. And people are originally doing the work that they're motivated about, and now they're disengaged, right? So how do we make that a topic that we can discuss among ourselves in order to provide a space people can support each other? Indeed, we are counselors, we are healthcare professionals in a way. We have the tools, to help people, and why not among ourselves, right? So in order to adjust that as something that we can take care of in the organization and the structure, I believe there's a shift that we need. So not just individual issues, but more about how we create the conditions to allow people to do the meaningful work together in a sustainable manner.
And obviously, workplace options trainings and organizations can implement those. And I'm sure how important is that as well, so that from the top down, this issue is getting addressed.
For sure. Very fortunately, we do have our supervision sessions. And then as well, just take myself as an example, I do what we call structured counseling as well. So I actually have additional supervision sessions, and we do that as a group, meaning it's not just our supervisors. We do have our fellow clinicians supporting each other during that session, during that group. So things like that would be super important. And for now, I believe as we are really transitioning to, sizing up the company, I believe this kind of work will be more and more in demand. So, yeah, I'm so glad that we're in a conversation to talk about it today. It's something that we definitely need to address in the time to come.
In your work, like you were saying, you do these group sessions. How have you seen that really impact people struggling with this?
I'm so glad that you've asked it. So from time to time, as you can imagine, us and clinicians, we do have our, limitations as human beings, right? And we really need to be seen in order to build trusting relationship to grow from it. And let's take it from a, more concrete point of view, if I may. So from time to time, when we have a certain client that we find a little difficult to work with, just an example here. So we need to talk about it, like what is kind of troubling us in order to have the opportunity for another individual to reflect on our experience. So listening from what the other person would have told us was very meaningful in a way that on one hand, they're providing the professional insight, and at the same time to providing us the emotional support that as human beings we all need. We all need to grow from there, from the support. It serves as the foundation, and not just personally, but also professionally. As early on I talked about the use of self, right? That's indeed something very related, and we need that to, need as a foundation in order to thrive in our work as well.
Thank you. So much good information so far. So thank you. And just, I guess, you've shared so much already, but anything else about how organizations really can implement strategies or any other comments just about why this issue is so important and so pressing that you haven't shared already?
Right. I'm so glad that you asked this, Emily. So I would say um, oftentimes we put emotional support in a position that, there's a certain input or extra input that the organization might have to put in order to, make that happen. So it's considered as a cost, right? And if I may add to that, I would definitely say as, um, compassion fatigue is impacting our professional work, there's this input needed to allow our work to be sustainable, right? So not only that, we're taking time for, whatever groups of vision or creating the environment that we support each other. That's indeed something we need to do. But at the same time, that will also feedback to the improvement of our service quality, for example, even service excellent, right? And you can imagine, in a group conversation, we're exchanging ideas. I do humanistic work. I do Gestalt therapy. So how would another individual, another clinician, right, for example, who does, let's say, CBT, cognitive behavioral therapy, might approach my case, right? With that exchange, we're learning from each other, and so as to, really make things of a high quality and improve our practices as well, right? So there's that. We learn from each other, and at the same time, we are in the hope of making things a little more sustainable. So instead of just go and go in our everyday routine, just going from one case jumping into another, we do need that mental space really in order to process stuff. And with the presence of another fellow clinician, we can process it a little better. We feel the support from each other in order to process it. So that's indeed feeding back to the sustainability of the work that we do. So with really feeding the presence of our fellow clinicians, the empathy, the attentiveness, we'll be able to allow things to be a little more sustainable. And I personally do not think, it's kind of taken away, too much from the work, because at the end of the day, it's going to feed back to the quality of the services as well. Let me just add to that.
So that totally makes sense. The amount of support will correlate with the quality of the work.
Sure,
Is what I understand by what you're saying. Yes, that makes
absolutely.
sense. But yeah, thank you. And just compassion fatigue as an issue, you know, have you covered most of what you've wanted to talk about that issue itself or anything else before we wrap up?
So if I may just add to, how we take care of burnout and fatigue in general, there's a saying, prevention is better than treatment, right? So if we may just put a little bit more emphasis on the prevention work, we definitely would need to normalize the conversation about stress, among ourselves, and to promote what we call psychological safety, whether we can talk, among each other about our concerns, about things that may have been challenging with us recently, be it, things in the workplace or things related to our just personal life, right? And every day, the support, the reflection in our practices, being able to be seen, be able to see each other and how each other are doing. I believe that's the key. And that kind of get back to the point of, whenever we discover something, there's something we can do for what we call early intervention, right? So I believe prevention is actually the key here.
prevention obviously is going to look like the ways that you had said earlier, and
Yeah.
that will obviously make a better workplace. All right. Well, thank you. Well, this has been an insightful conversation. Thank you so much, Kender, for joining me today and for sharing your insights with all of us. And to our listeners, thank you so much for tuning in. Be sure to stay tuned for future podcasts where we'll explore the effects of burnout on caregiving, staff at schools, and across the broader workforce. Until then, thanks for listening and take care. And thanks again, Kender.
Thank you so much, Emily.